Could you explain a little bit like how the way that you treat this patient, how does that work?
Okay, so patients' initial visits are a musculoskeletal evaluation, just like you would do for back pain, lower extremity, whatever. You know, the standard, you know, trunk motion, lower extremity strength, all that. My goal in working with any of my clients or patients is to support them in what I call a healing dialogue with their body, to increase awareness of their breath and some habits they may have that with posturally, and then educate them on the core musculoskeletal so they kind of understand why it's not just about the pelvic floor. So pelvic floor dysfunction is not just about the pelvic floor. So in treating them, at their first visit, I pull out a Netter anatomy that shows the relationship between the diaphragm, the pelvic floor, the abdominals, the lumbar paraspinals, the hips, so that it kind of makes sense that it's all connected. And then I will start with relaxation techniques. One of the important things in working with individuals who have either bowel, bladder, painful intercourse, or genital pain conditions that have not been, no one's been able to figure out what's going on. There's a sympathetic input to the urethral sphincters and the pelvic floor and the piriformis and all obturator and turnus, that when there's a stress level, which everybody's kind of tapped out right now anyway, I think, muscles don't relax until you address the whole parasympathetic sympathetic system. So starting with relaxation techniques is important to me. And so I start with a breath awareness. I teach them how to, you know, notice how you're breathing, and then I'll teach them what I call pelvic diaphragmatic breath exercise, and also use body scans often. I'm trying to get them to connect inside themselves instead of outside with all the stresses and factors that are going on, feeding into what can cause more pelvic conditions. Does that make sense?
Yeah.
So I start with that, and then a lot of awareness techniques, like educating them on postural awareness. What habits do you have? Crossing your legs, slumping, all those kinds of things that therapists will talk about. Noticing breath holding patterns they might have with daily activities or exercises. I talk about what's normal for bowel and bladder habits, and I may have them do a bowel and bladder diary to see how often they're going or what issues they're having there. Also considering, have them look at food and beverage diaries. So is there something there that's feeding into increased tone of pelvic function or whatever? But pelvic floor specifically, on therapists that are trained in addressing specific pelvic floor, which is a manual assessment, it's very helpful to know what a patient's specific pelvic floor function is. And everybody knows, or most people know the term Kegel or Kegel, but just because you know the term doesn't mean you're doing it correctly. So there's different things to check as far as assessing pelvic floor function. Are they able to relax as well as they can contract? Can they not contract at all? So depending on what that assessment reveals on individuals, I may have them do relaxation techniques, just noticing, is the pelvic floor relaxed or not? Or if they can contract, but can they also notice the relaxed face? So, and then of course, including any weakness or tightness as far as abdominals, hips, lumbar paraspinals. Is there any limitation in lumbar mobility? Is there an SI joint dysfunction that needs to be addressed manually? And then there are other types of treatment modalities like biofeedback, pessaries. I use a lot of kinesiotape because I like how it stabilizes your core when you're doing functional activities, so it takes some of the stress off the pelvic floor. Those kinds of things.
Yeah, that's nice. I imagine how hard it's probably to try to make the client understand like how to relax and be aware of that, because we treating necks, they can relax their neck in our hands.
Oh, yeah.
I just imagine like how hard I would be. Like 100 times harder to to reach
Right.
that goal. I was like, yeah, that's a challenge. I just work with the type of patients during college, and then after that I never had any contact. I just imagine like on the daily life how hard probably is, right, to get them to work the area, be aware, and if it's
Right.
relaxing it, if it's tight, it's like